Are you aware that 70% of what we buy in grocery stores is ultra-processed? This shocking statistic reveals an urgent public health crisis. Gerald Monde, a Harvard Chan professor, reveals how these foods impact our health. Let's break down the issue of ultra-processed foods and discover solutions. Ultra-processed foods are linked to severe health problems, both physical and mental. Consumption leads to chronic diseases, ultimately shortening our lifespans. In fact, Americans today live shorter lives than counterparts in other countries. Deaths from despair contribute, but the main issue lies in our diets. Children are not spared either. Today's youth face obesity, diabetes, and even fatty liver disease, which was rare decades ago. What can the next U.S. administration do about this mounting problem? First, lack of coordinated effort across government agencies is a challenge. No single authority oversees our food's health impact. Furthermore, insufficient investment in nutrition science hampers progress. Less than 5% of the National Institutes of Health budget goes to nutrition research. The lobbying power of the food industry complicates matters further. Lack of proper research leaves policies based on incomplete science, which is a significant hurdle. So, what should be the policy recommendations? Investing in nutrition research is crucial. The establishment of a 50-bed facility for advanced study of diets could refine our approach. Considering how quickly COVID-19 vaccines were developed with proper resources, we can make strides against ultra-processed food issues too. Next, prioritize children's health. Ensuring that every American child reaches the age of 18 with healthy weight and metabolism should be a goal. We can also strengthen existing standards like the WIC program, which is vital for low-income families. Increasing participation among eligible children can improve outcomes significantly. The FDA must update its definition of whole grains, ensuring it aligns with health standards. Stronger nutrition standards should be bolstered in childcare and school meals as they are crucial for child development. Universal school meals can ensure that children receive adequate nutrition. Regulating the promotion of ultra-processed foods is vital. For example, leveraging the $120 billion SNAP program to limit unhealthy food promotions can lead to healthier choices for all. Lastly, the new dietary guidelines should address ultra-processed foods explicitly. Silence on this issue could delay progress for another decade. The evidence supporting these recommendations is compelling. Obesity rates have surged since 1990, rising from fewer than 15% to nearly every state exceeding 30%. Additionally, NIH studies showcased how participants gained weight on ultra-processed diets, despite equal caloric intake. Understanding why these foods are harmful is complex. The combination of high caloric density and hyperpalatability makes these foods incredibly appealing, contributing to addiction-like behaviors. The FDA and USDA have sufficient authority to regulate harmful foods, yet they focus little on chronic illness linked to diets. This neglect must change. We have the power to treat ultra-processed foods as a public health crisis. By applying what we learned from tobacco regulation, we can protect future generations from the dangers of unhealthy diets. Join the panel discussion hosted by Harvard Chan Studio to explore the devastation of ultra-processed foods and tips for healthier living. Let's tackle this public health issue together. For more insights, subscribe to our channel and share this video. Let's educate ourselves and advocate for better food policies.
Thanks for watching Zenvix. Subscribe for smarter health and science.